Topical treatments for eczema.
After we understand the foundation of maintaining a healthy skin barrier and we still have eczema, our first step is usually to talk about controlling that eczema and inflammation and overactive branch of the immune system locally using a cream, a lotion, or an ointment that delivers medication to the active site of the eczema. And we know that these medications can be topical corticosteroids, or they can be creams and ointments that contain other medications that are not steroids. We know that both of these types of treatments can have they can be really great treatments for eczema if we know how to use them properly. So the general principle is to remember that one of the things we know we want to do is to treat eczema quickly until the skin barrier is healthy again. And then the next step is to figure out how to maintain that skin barrier health in the long term. So that if we need to control eczema quickly locally, the benefit of using a cream, a steroid, for example, on the skin is that you can actually treat and deliver the medication just to that local area without exposing the entire health system of your body to a medication taken systemically by mouth or delivered in other ways. So we usually start with this, and the range of topical corticosteroid strength is really enormous. You can think of it as stretching all the way from the floor up to the ceiling in its strength, or else I like to call, the baby strength, the mommy strength, and the daddy strength. But there's lots of different ways of thinking about this. And overall, what we generally choose is a treatment that is assigned to a specific region on your body, because we know that the eyelids need a different strength of cream than your hands, where the skin is very thick. So overall, using your topical medication, your corticosteroid matched to your eczema and the site of your eczema is a great way to put the eczema to sleep very quickly. And usually what we see is that those medications are often just not used enough or for long enough, so that actually covering the surface of the eczema like a moisturizing cream with your treatment cream, and then using that twice a day until the skin feels soft and smooth is really important. And then that the medication be gradually tapered off is also an important principle. And some people may need to continue to use their medications on the weekends or once or twice a week to maintain that response. Another option is to switch when your skin is doing better to another type of medication, something like a topical calcineurin inhibitor, where you have medications like Topical and Elidel. We also have newer medications like Eucrisa, which are based on different molecules that can also help to control the immune system in more targeted ways on the skin. And the principle of those creams is the same, in the sense that you want to use them to cover the eczema sufficiently and in enough volume that they can prevent the disease from being overactive in the long term.